Local educators are taking a closer look at a vision issue that few of us have even really heard of, but it could affect as many as 1 in 30 children. It's called CVI, and it's often misdiagnosed.
And as Boston 25's Jim Morelli shows us, the Perkins School in Watertown is working to change that.
The CDC says about 7 million children in the United States have been diagnosed with ADHD. But could it actually be something else, such as a form of blindness? Do you know what color your eyes are?
Brown. But that's because I've been told they're brown.
19-year-old Kyle Butt is a student at the Perkins School for the Blind. Only he's not exactly blind.
When I was born, I was diagnosed with pediatric epilepsy.
He underwent a drastic surgical procedure in which doctors removed seizure-producing brain tissue.
Doctors didn't know if I was going to be able to walk or talk ever again. And now my parents say I talk too much.
But Kyle did lose peripheral vision, and he was left with a condition called cerebral cortical visual impairment, or CVI.
It's the leading cause of visual impairment in all developed countries.
Ilse Willems is senior director of the CVI Center at Perkins.
Whenever we look at anything, the eye will take kind of essentially a photograph of what you're looking at, a photo, and then that image gets sent all the way to the back of the brain.
The brain figures out what's in that photo and relays the information back to the eye. In those with CVI, that pathway is damaged.
And so our students might be able to look and take that clear photograph, but they're not able to easily recognize what's in front of them.
So you were saying that people could have 20/20 vision and in all respects optically they're fine.
Yeah, exactly.
That means there's no easy way to test for CVI, and Willems says new research shows it's massively underdiagnosed.
And it showed that less than 20% of those with CVI in the United States have a diagnosis.
And some are misdiagnosed. Because more than anything else, CVI leads to frustration, the kind that could be mistaken for such disorders as ADHD.
They're putting their head down, they're pushing things away. A teacher sees that in the classroom, they might not recognize the student is just getting frustrated that they can't access their materials.
You might suspect CVI if your child looks at things differently, has trouble recognizing items or people, gets visually tired easily, or has trouble with school tasks. Though there is not a diagnostic test, Perkins does have a list of doctors with experience evaluating CVI. That would be the first step in getting helpful interventions both at home and at school. Kyle wasn't diagnosed with CVI until he was 16 and spent several difficult years in public school. At Perkins, teachers cater to his strengths, such as voice recognition. Predictability, planning, and organization have been the keys to his success. And he is succeeding. Kyle is preparing to take his first college course and dreams of becoming a meteorologist.
That's one thing that I want to do is as a career.
The Perkins School tells us that the National Institutes of Health is now making CVI a priority to improve diagnosis and rehabilitation. In Boston, Jim Morelli for your local station, Boston 25 News.